A very good morning to everyone who's joined in today. Respected Dr. Shiv Kumar Sareen, Dr. Vinod Paul, Dr. Razia Pense, Dr. Ramesh Kapil, representatives from the WHO Southeast Asia region member states, and distinguished colleagues. I extend a very warm welcome from the Institute of Liver and Biliary Sciences to this international webinar on integration of non-alcoholic fatty liver disease into the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease, and Stroke. We are truly grateful to everyone who could join in, and I thank you profusely for having set out the time to participate in this very important webinar. It's said that the prevention and management of non-communicable diseases is the litmus test for health system strengthening in countries. A targeted response to NCDs demands foresight, long-term planning, consistent investment, and concerted action. Exactly a year ago, the Government of India and its planning department, the Niti Aayog, have taken due cognizance of the grave public health implications of non-alcoholic fatty liver disease and initiated preemptive measures to counter this potential threat. The Ministry of Health and Family Welfare, Government of India, integrated the public health measures to prevent NAFLD into the National Program for NCDs. And the operational guidelines for these public health measures were released on 22nd February 2021. The coming decades is likely to witness a rising burden of NAFLD, a burden that is staggering, it's likely to outpace diabetes. And we will see in the course of this webinar the compelling evidence of the close bidirectional association of NAFLD with other non-communicable diseases. It's clear from the evidence out there that this is a multisystemic disease with extrahepatic complications, which calls for a paradigm shift from a liver-centric approach to a holistic management with a strong primary care component. However, unlike other pervasive and very highly prevalent conditions, NAFLD has received little attention from the global public health community, and public health measures for this have been generally nascent, with most international strategies and national policies not addressing the public health measures for NAFLD. So this landmark integration is envisaged to facilitate prevention and management of NAFLD at various levels of healthcare and eventually result in a reduction in incidence of NCDs in the long run. So this strategy is envisaged to holistically address NCDs, including not just NAFLD, but also other diseases such as diabetes and obesity. And this webinar is organized to draw attention to the much needed paradigm shift in the approach to prevention and management of NAFLD, which is in need for a strong primary care component. This webinar aims to initiate dialogue and discussion around NAFLD throughout the WHO CRO region. And we wish to gain valuable insights into what strategies would work at different parts of the world from you, our distinguished colleagues. We feel multilateral organizations such as the WHO provide the most valuable platform for stimulating the emergence of a global movement to prevent NAFLD, the most common chronic liver disease worldwide. The Institute of Liver and Biliary Sciences, a liver-centric university, recognizes the need for placing preventable liver diseases on the public health agenda. And we have a stellar panel of speakers on the agenda today, all of whom have had key roles in shaping and helping lead the response to NAFLD and other NCDs worldwide. So I extend a very warm welcome to all of you once again for lending your support in advancing the global public health agenda for NCDs, including NAFLD.